When is your headache not an emergency? Imagine feeling a headache coming on and wondering if it's something serious or just a normal pain. Sometimes headaches can be signs of a bigger problem that needs quick medical attention. Other times, they are just annoying but not dangerous. So, how do you tell the difference? Most headaches, like tension headaches or regular migraines, don't need a trip to the emergency room. If your headache follows a pattern you're used to, it's probably not an emergency. For example, if you often get migraines that respond well to your usual medicine, it's likely safe to treat at home. If the pain gets better with over-the-counter medicines like acetaminophen or ibuprofen, that's a good sign it's not serious. Headaches that develop slowly and don't come with new symptoms are usually manageable outside the emergency room. If you've had headaches like this before and they don't change, it's probably okay to wait and see your doctor later. Also, if your headache isn't accompanied by neurological symptoms like weakness, numbness, trouble speaking, or vision problems, it's less likely to be an emergency. If your headache happens without fever, stiff neck, or confusion, it's usually not urgent. Headaches that follow a minor head injury but don't cause worsening symptoms are often less serious. If you're over 50 and suddenly get a headache for the first time, it's wise to see a doctor, but it might not be an emergency unless other signs are present. A sudden headache that hits at full force within seconds, often called a thunderclap headache, is a warning sign that needs immediate attention. If your headache is the worst you've ever felt, don't wait, go to the emergency room. Headaches with neurological signs like difficulty speaking, weakness on one side of your body, or sudden vision changes are urgent. If you experience confusion, vomiting, or loss of consciousness after a head injury, these are signs of a serious problem like bleeding or brain injury. If your headache comes with fever, stiff neck, or sensitivity to light, it could be meningitis, which needs urgent care. Also, if you notice a new, persistent headache that doesn't get better or is worsening despite treatment, it's time to see a doctor. In summary, if your headache feels familiar, responds to your usual treatment, and has no new or severe symptoms, it's likely not an emergency. But if it's sudden, severe, or linked to neurological issues, fever, or head trauma, seek emergency care right away. Knowing these signs can help you stay safe and get the right treatment when needed.